Hello. Our health is always an issue. The state of medical affairs in Atlanta is always of a concern. Joining me now is Dr. David Anderson, the Vice Chair of the Department of Medicine at Morehouse Medical School and one of Atlanta's top internists. Your specialty, as I understand it, is hypertension, high blood pressure, and as I understand it, also prostate cancer. But what do you see the most? What concerns you most about the state of our health here in Atlanta? Some of the patients you see at both the school and here in your office?
Well, for me, the state of the health of Atlantans is probably best viewed in terms of what we're doing for those who are the least among us as far as their socioeconomic standing. I practice at Grady Hospital, and there I see a lot of patients who unfortunately are coming in with diseases that are preventable, or they come in with their disease condition so far advanced because of lack of adequate preventive care and adequate primary care. And unfortunately, with the changes that we have seen economically, with downturn in the financial situation, and people losing their jobs
and their
health insurance, we're seeing more people coming into the Grady system seeking health care. But even more disturbing, we have people who are not seeking health care because they think, one, they cannot afford it, it's just out of their reach, and then they come through the emergency room sicker than they probably would if they were being followed on a regular basis and getting timely medical care.
Is that where we really see the difference between the haves and have-nots in our health care? I mean, is it really those who are sicker and die sooner, the ones who don't have insurance, who can't afford your services?
Basically, we all know that those who get timely primary care, timely preventive services done have a better chance of living longer. We know, let's say for instance, patients who get screened for colorectal cancer at a timely manner can be caught at stages where they may have polyps that are precancerous. You remove those precancerous lesions and you can actually prevent the cancer from developing. Those folks are likely to have a longer life, and not just a longer life, because we don't just want to live longer, we want to be healthy. So, you know, by doing timely screening and proper primary care, you can keep people healthy longer and prevent unnecessary deaths.
But if I don't have insurance, and I don't, how do you get that primary care? Because you're not going to treat me for free. You can't afford to, I imagine.
Well, no, we can't afford to treat you for free. However, there are places like Grady Hospital that still exist where we have a number of primary care clinics at Grady. And at Grady, you can be treated for a nominal fee depending on your ability to pay. The fee schedule there is one that is sliding, and the better your ability to pay, the more you will be asked to shoulder that burden. However, there are folks who are receiving care who have no insurance, no income, but if they are living within the Fulton and DeKalb County areas that contribute financially to Grady, they can come there and still get the kind of care that you could get in a private doctor's office. They're going to get their screening.
While we know Grady's a lifeline, God bless it, there are those who suggest or say, if you're a poor patient, or if you're depending on services at Grady or without insurance, you're not going to get a top-notch quality of care. Is that a fact or fiction?
Fiction. Yeah. Fiction. Grady Hospital has, first of all, Grady is a teaching hospital.
Sure.
Morehouse School of Medicine and Emory University School of Medicine, both schools have their residents there, their medical students there, and senior faculty members like myself. There, I see my own group of patients at Grady Hospital, and I also supervise the residents in their management of patients at Grady. The care that I provide to patients at Grady is no less and no different from what I would provide to a private patient seeing me in our faculty practice.
So their ability to pay, does it impact your attentiveness, your diagnosis?
Absolutely not.
Your
Absolutely.
bedside manner?
No, has absolutely no effect. I've been treating patients at Grady now from 1992. And I have a large group of patients who are my patients. They'll tell you, Dr. Anderson is my doctor. And they call just like someone who has insurance at my private office would, and I provide the best care I know how to them, regardless of their ability to pay or not.
Then why, given that availability of services, even for those without insurance, why are there people waiting longer or not? Is that their own fault then? Because the services you suggested are available, but you're seeing sicker and sicker people.
Right. Well, the reason why people wait or do not come in a timely fashion to see the doctor, although there are places like Grady, are several reasons. One is the notion that if I don't get it checked, then I do not have it.
You can hit the nail on the head with me.
If I don't get my blood pressure checked, then I don't have hypertension. Well, how do you know that if you don't have it checked?
Right.
If I never get my blood sugar checked, then I don't have diabetes. And so these are the folks who, although there is a place like Grady, we don't see them until they have symptoms of their condition.
Or a crisis. Huh?
A crisis situation, because they are coming to us through the emergency room instead of coming to us through the medical clinic for that yearly exam.
I see.
They hardly come in for that yearly exam. And unfortunately, black males are notorious for that.
For waiting till the last minute.
For waiting until the last minute.
What do you see mostly among black males? Hypertension, prostate. What's the most common ailment that you diagnose, that you treat?
Hypertension and diabetes are by far the two big ones. We do see a fair amount of prostate cancer, but hypertension, diabetes, and the consequences of those two diseases, kidney failure, we see a lot of that in our community.
High blood pressure. Once you start taking pills, I take several pills with high blood pressure. Is there ever an end to that? I mean, does it become increasingly more pill problematic, or is there a cure for that? I guess is the question I'm asking. Or is it just a maintenance of it?
I'm not going to say there's a cure for hypertension, but it is manageable, and it can be managed in some patients without medications, mainly through diet and exercise. There is a diet called the DASH diet, Dietary Approaches to Stop Hypertension, which was put out several years ago by the government. And it's a diet that emphasizes high fiber, low fat, and protein, but not so much in terms of red meat. Of course, you're going to get your vegetables in there too. And people who have gone on the DASH diet have been able to lose weight and lower the blood pressure. And for a patient who might have what we consider as stage 1 hypertension, they might be able to lower their blood pressure sufficiently that they could get off medication or not even get started on it in the first place. That doesn't mean they don't have hypertension. Right. It is just that they're managing it without medication. Okay?
Prostate cancer. Is that, I mean, you say high blood pressure, hypertension is a silent killer, but prostate cancer is up there as well, I imagine, because how do you really know whether your prostate is enlarged, or you should seek a doctor's care?
Well, prostate cancer, the signs and symptoms of prostate cancer are not unique to prostate cancer. They are the same signs and symptoms that you might have if you were having an enlarged prostate. Those symptoms could be frequent urination, getting up at night frequently to urinate, hesitation when you go to urinate, you go to the bathroom to pass urine, and you're ready to urinate, but nothing is coming. A very weak urinary stream. Okay, those are some of the symptoms of prostate problems.
No pain necessarily?
No, you don't necessarily have to have pain to go along with that. In fact, most times, patient will not have pain. What they have is just that need to urinate frequently. They have a dribbling at the end of urination, and they feel as if they never fully empty the bladders. So they have to keep going back. All right? But those are the same symptoms that you might have with prostate cancer. Now, to help make a diagnosis of prostate cancer, the American Cancer Society recommends that we have a very frank discussion with our patients about screening and let them know the benefits as well as the risks of screening for prostate cancer. And if the patient is willing to go along with the screening, then we would do a digital rectal exam, okay, which is basically inserting the examination finger into the rectum gently and examine the prostate, feeling for any nodules, feeling for any hardness or differences in the lobes of the prostate that might be suggestive of prostate cancer.
Is that your expertise? That's what you're.
That's an area. That's an area that I have a lot of interest in.
Why is there a lot of interest? Why do you say it like that? Because of its.
Well, for several reasons. One, it is very common among black men.
Yeah.
Also, I'm from Jamaica, and Jamaican men seem to be affected at a very high rate also.